So I'm Stacey Lambert, and I am a clinical psychologist, and I run our clinical psychology department here. All right, so this slide here echoes what Dr. LeBoy had said earlier, and it's really a key theme of our message today about careers in psychology or careers in mental health, is we want you to be informed consumers, and it's a very personal decision. You need to consider what's the best match for you in terms of how do you imagine your career trajectory and how do you want to spend your days, what populations you like to work with. So one of the things that you all have the opportunity of is to be much more informed than maybe any of us were when we were going. You know, I was I hate to admit it, before the age of internet, you know, and so you got your information from your friends. What does a clinical psychologist do, and what does a school psychologist do? And now there's so much information out there, so I would say please definitely avail yourself of that now so that you can make a good decision. We don't, in clinical psychology, typically have a 9-month schedule or maybe some of the bells and whistles of school psychology, but we do have a lot of really interesting psychopathology. So if you remember from your undergraduate, if you took an abnormal psychology class and you thought, wow, that's wildly interesting, that's clinical psychology. So we tend to focus on people with psychopathologies ranging from, say, depression to anxiety disorders, schizophrenia, substance abuse. We also get involved in behavioral work, and Ronald's information was resonating with me as well, that lifestyle choices people make, a lot of them, if you think of the top causes of death in the country, a lot of them are influenced or mediated by behavioral factors and lifestyle choices. So we as clinical psychologists focus on assessment and intervention and with all of these various conditions. Okay, so if you are interested in being a clinical doctoral student, the first thing you want to do is find an APA accredited program. So we are one of them, but there are many of them in the country. And so again, echoing back to Dr. LeBoy, you want to do your research and say, what is the milieu of the program? What do they emphasize? And what's the right size of program? How does this suit me? But APA accredited, if you were to, I don't know if anybody uses TripAdvisor or Yelp when you find a restaurant or that kind of thing, but APA is a seal of approval that says the doctoral program will have the right number of credits to get you licensed. It covers the right number of courses. It has the right clinical experiences, the field placement, and all of that. So it's really a seal of approval that if you pick an APA accredited program, you can't go wrong. And then at the global level, at the finer level, you want to look at the different programs and see the faculty and the bells and whistles that the different programs offer. But you definitely want the APA accreditation. I have here, and I would refer you to the different schools that you're looking at to take a look at their student outcomes website. APA does something that's really a good value for students who are shopping clinical psychology programs. They make all APA accredited doctoral programs have a student outcomes data posted on their website in the same format, so you can compare apples to apples for every school. So you're not trying to see how is one marketing department presenting it, and so you can see the attrition rate, the tuition cost, the licensure rate, the EPPP performance, and things of that nature. So I definitely suggest you do your research on that. And then consider, obviously, we talked about location. Do you want to be in New England or Midwest? Where do you want to go to school? Smaller program versus larger program. Thinking back to when you made your choices about undergraduate, some people really flourish in a big environment where there's lots of resources, and other people really want a much more intimate experience. And so that is an important thought. Your concentration offerings. So all doctoral work is actually generalist. By APA rule on their standards, they insist that you be a well-rounded psychologist, which makes sense that psychologists end up performing so many different roles in their employment settings that it's important that even if I'm going to be a clinical psychologist working with adults come with children, or children come with parents. And so we need to understand across the lifespan, and so clinical psychology is generalist in that way. However, probably in the last 15 years, concentrations have become more prevalent. Concentrations are optional at the doctoral level. They're not required, but many schools are offering concentrations. It's basically, if you have a sense of a specialty area at the doctoral level, you can begin to put your toe in the water and say, you know, I'd like to do some of my practicum work with that population, or I would like to do my doctoral project or dissertation and learn more about that population. I would like to take a number of electives on that population. So common concentrations would be health psychology, as I alluded to earlier, neuropsychology, forensic psychology, which they do come with good pensions if you work in a prison system. So if you love clinical psychology but can't want to forego the pension, the prison system is great, early retirement, etc. There's a great up-and-coming field that nobody seems to be interested in, and so kind of like Dr. Silva was saying, well, you want to go into something that has lots of career prospects for you, and so geropsychology, we have a geropsychology concentration, and it's not wildly popular, and if you think of the graying of America, it's how it's referred to, the baby boomers and the population trends, there's going to be so many more older adults that are severely in need of clinical psychology services, and very few geropsychologists out there. So a concentration offering at a particular school may lead you to say, I want to go there, or we have a great military and vets program that may lead you to have some interest in one school versus another. And then this is an age-old question, and people really struggle with this. Anybody here struggling with this ID versus PhD? Yeah, right? It's a hard decision. But this also really goes back to the idea of, how do I want to spend my career? And it's hard to fully know because you haven't been exposed to all of the options, and so hopefully you get some time to, before you enter graduate school, to serve as a TA or serve as a teaching assistant or a research assistant or do some volunteer work so you can see a clinical psychologist. Any given clinical psychologist has a pie chart, and if you say, what does my pie chart look like? I do a lot of administration, a little bit of teaching, and I don't do clinical practice anymore. I used to, if you ask me what my pie chart looked like 20 years ago, it used to be a lot of clinical service, a little bit of teaching, a little bit of administration. So my pie chart has evolved over time, but when you're choosing between a PsyD and a PhD, you want to think about, do I want to have a lot of research and create new psychological theory and interventions? Do I want to have a lot of teaching? Those are reasons that you might consider getting the PhD, because you're going to have more opportunities with the PhD to do those activities. It doesn't mean you can't teach with a PsyD. I have a PsyD. I teach with a PsyD. I've taught with a PsyD. However, you're going to be competitive for the most number of academic positions with a PhD. So if that's really how you read the tea leaves of what you'd love to do and what you're passionate about, having those research skills and so that you can produce the amount of research that you need to get tenure, you'd be better with the PhD. If you love direct service, and you think, I want to be more applied, psychology is more interesting to me. To be a doctorate, you must write a doctoral project or a dissertation. So even if you get a PsyD, there's a research component to it. So if you don't like the research at all, master's would be a better fit for you. But it's smaller in scope. The amount of emphasis on research versus clinical practice is smaller in scope in a PsyD versus PhD. So that's really the decision point. But some PsyDs come to us erroneously, or PsyD students come and say, you know what, I love clinical work and that's what I want to do, so that's why I want a PsyD and not a PhD, and I'm sure of it, but they just want to do direct service. And then we say, you know what, master's program is actually a better degree. It's faster and you don't over-educate yourself out of being able to do direct service. As a psychologist, you have a doctoral degree, you want to command a doctoral salary, and the opportunities that will be available to you, you'll be expected to do things in addition to providing psychotherapy. They're going to want you to be a program designer, a program leader, administrator, supervisor, so you're going to perform a lot of different roles. Psychotherapy is one among them, but it's not your full extent of what you're going to do. We do a lot of things really well at our particular program, so I would call you to our website to take a look at it. But some of the things that you won't see on the website, you have to get by actually seeing the program, meeting the faculty. So I would encourage you to come to one of our open houses. If you say, clinical psychology is the career path for me and I'm actually interested in William James, do come, meet us, get a sense of our flavor, see what the milieu of our program is, and we would love to have you and get to know you.